Welcome, everyone. Good afternoon. My name is Inder Kaldra. I am a CL psychiatrist at Jefferson Einstein Health in Philadelphia, and I'm representing Mentorship Subcommittee along with Priya Gopalan. We're really happy to be working along with the annual meeting subcommittee, oral paper posters, and DEI to bring you um, the Zoom live session today on best practices and tip for the annual meeting submissions in 2025. This year's theme is Innovation in CL Psychiatry, Exploring the Pitfalls and Promises of New Approaches. For those of you who've not heard this before, we've done this in the past years. We're going to be going through the different type of submissions. Again, about the pre-conference courses, oral papers and posters, general sessions, and what is new in this year's meeting. We have Chris Solano, the scientific chair of this year's meeting, and he's going to be introducing as we start today. Welcome, everyone.
Thank you very much, Inder, and welcome everybody. Certainly on behalf of the annual meeting committee, thank you so much for coming. We are very excited about this year's meeting. Next slide. So today I'm going to be talking about 5 different things. I'd like to talk a little bit about the theme and some of the things we're excited about in terms of the theme. I'll mention some of the high priority topics for this year, which is something new that we have this year from prior years. We'll talk a little bit about the timeline for abstract submission and then going up to the annual meeting. I'll highlight some of the important kind of changes that have happened to the meeting this year and make some clarifications about some of the policies for the annual meeting. And then hopefully just end with a few words of encouragement for folks as you're submitting abstracts and getting kind of feedback from them. Next. So the theme for this year really focuses on innovation. And so it's called Innovation in CL Psychiatry, the Promise and Pitfalls of New Approaches. And really, we were trying to go for 2 different things. The first thing was the innovation part. We're really excited about trying to make CL psychiatry more innovative. And so we have a number of plenary speakers that are going to talk on some innovative topics, including women's healthcare, artificial intelligence and its applications for CL psychiatrists, as well as optogenetics, which is really kind of a way of kind of developing certain neurons that are responsive to different wavelengths of light. So you can actually kind of use these different light frequencies or wavelengths to actually activate different networks of neurons within the brain and better understand how the brain works in different types of psychiatric problems. So we're really excited about those plenaries. And then we also have some general sessions that we invited related to translational research, which will feature some of the people who recently completed the Developing Scholarship and Research Colloquium at ACLP, as well as another talk about innovations in education. So different ways that we try to teach CL psychiatry to trainees and colleagues in the hospital. Now, the other part of it, the other part of the theme is really kind of trying to be thoughtful about innovation and really trying to think about kind of the pros and cons of innovative approaches that we're developing. And so as part of that, we wanted to really encourage people with diverse perspectives to kind of talk to each other and to present that kind of information at the meeting. So we certainly would value that in abstract submissions. If you have a particular topic that has multiple viewpoints, that would be great. So in terms of our debate this year, which is not really a debate, but is more of a discussion, we're going to be talking about physician-assisted suicide and medical aid in dying in kind of CL settings. So we're going to have one speaker who's going to talk about, why they would be in favor of this, and another one who's going to talk about why they would be against this and what the arguments are, really to just help all of our membership kind of understand the different perspectives of people. We also are going to have a couple of things that focus on similar topics. So we'll have negotiation, which really focuses on trying to kind of bring people with different perspectives together to try to kind of work towards a common goal. And then advocacy. So if you have a particular perspective and you want to try to make change within your hospital or other organization, how can you kind of go about doing that? Next slide. So this year is the first year we're going to have these high priority topics. One caveat is that by no means does your submission have to be on one of these high priority topics. These are really kind of were chosen based on either this year's theme or feedback that we got from previous years' annual meeting surveys where people said they wanted to hear more about these things and weren't seeing them in the meeting. So these are just kind of ideas for you to kind of think about, because we know people want to hear about them. And we haven't had enough submissions on these topics in the past. And so if you can do something related to this, that's great. But if your research is not in one of these areas, totally fine. You can still submit that, and it could certainly be judged well as well. Next slide. So in terms of the timeline for submissions, so March 3rd, abstract submissions already opened, and they're going to stay open until April 1st, which is the deadline for abstract submissions. We would hope over the next 2 months to be able to grade all of the submissions. This goes through kind of a multi-tiered process of grading, which the general sessions and other folks will kind of talk about. But you'll get acceptance in June, and then the annual meeting is in November. Next slide. So in terms of highlights, I would say the first big one is that we're starting earlier. So one of the biggest pieces of feedback we've had for previous annual meetings is that we don't accept enough content. And the problem has been that we don't have enough time to actually get all of the content in there. So we're going to be starting on Wednesday at 1 p.m., which will allow us to accept at least 20 more general sessions. We'll also be able to increase our number of brief oral papers that we accept for in-person presentations. And we're also going to be shifting our poster session from 1 poster session into 2. One will be on Wednesday evening and one will be on Thursday evening. These will be a little bit smaller than the one altogether, but it'll still allow us to accept more posters. So we're very excited about that. Additionally, because we're kind of shifting earlier, we are moving our skills courses to Wednesday morning, and we are going to shift our updates courses to being virtual. We are going to feature them and send them out to membership in the 4 weeks leading up to the annual meeting, so that each of these updates courses should hopefully be able to get a lot of attention. So if you're interested in that, this could be a great way to be seen by a lot of membership. One of the other new things is that as we're moving to a new management company, we are going to have a new abstract submission system. So that is up and running. I have tested it. We've had several people test it. I think it seems to work smoothly, but who knows? It may not. It may all fall apart at the end of the day, but hopefully it won't. So if we have a kind of a whole nice submission document that kind of guides you through the process of submitting things. And I think this is actually going to be very good for us because it's going to help us to better match abstracts to reviewers. We have 150 abstract reviewers already who have kind of signed up to review abstracts. So this will help us to pair them a little bit better, and it'll hopefully give us a better experience on the at the annual meeting time when we have a new app and a new website that makes it easier to find things. Just as with last year, we do have both in-person and virtual options for our general sessions and our brief oral papers. So if for some reason you can't make it to the meeting, but you still want to submit something, there are options for doing that. You just start your kind of regular general session or brief oral paper submission, and you'll get the opportunity to say whether you want it to be in person or virtual. One other thing that kind of came up this year and that we've been talking about over the past year as well is SIG and committee sponsorship of submissions. So when this kind of first started, I think the idea was really to try to get SIGs and committees to work together to create submissions. And over the past several years, it's gotten a little bit different where SIGs and committees are kind of like advertising that they'll sponsor kind of anything that any of their members are submitting. And the fact of the matter is it never actually factored into how submissions were judged. So this year we are going to kind of hold off on official SIG committee sponsorship. So there is no official kind of tag or label of sponsorship for SIGs and committees, but we certainly would still encourage SIGs and committees to work together and have people submit things. But it led to a lot of confusion last year. And so I think our hope this year is to just kind of clarify that so that folks don't think that they're doing something that's going to gain them an advantage when they're really not. The next thing is speaker limits. So in previous years, one of the biggest pieces of feedback we've had is that sometimes the same speaker can give way too many presentations, like 6 or 7 presentations. And so we've tried over the past several years to limit the number of presentations people can submit. And last year it was actually done at the time of acceptance. So if people kind of submitted multiple submissions and they got 5 accepted, they'd be told that, you can only do 3, so you got to find a replacement or something like that, which didn't seem quite fair because other people would actually just submit 3 rather than submitting 5 or 6 of them. And so this year, with the new software, we're able to look and see how many you've submitted. So you are now limited to submitting 3. That's the number, and it's going to be done at the time of submission. So once that happens, if we find that you've done more than 3, you're going to be asked to remove one of them. This is really to help kind of have a more diverse set of speakers that are presenting at the annual meeting. And then finally, we have this contribution to CLP 2025 statement. So in the past few years, we've had kind of a DEI statement that talked about the Academy's commitment to DEI and accessibility. Because certain kind of members now are not able to answer those kinds of questions, if they're kind of government employees or members of certain institutions, they're just not able to answer that question. So we kind of thought about this and decided to try to make it a broader question. So next slide. So this is what the actual statement is. So it basically, this is in my view, this is kind of the way that you can kind of make your pitch to your abstract reviewers as to what your abstract adds to the annual meeting. This could be because it's studying a novel area or a novel topic. It could be a new research methodology. It could be because it's focused on a diverse kind of population of patients that is understudied, or it could have kind of a broad speaker panel with a number of different people at different career stages. There's lots of ways that your kind of submission can contribute to CLP 2025, and our goal is really to have kind of as wide and as deep a range of submissions as we can, so that everybody who comes to ACLP 2025 really can have a great experience and find something that they're interested in. Finally, I wanted to offer a few words of encouragement. Annual meeting submissions are competitive. These are the numbers from last year. So we only were able to accept 35% of general session submissions last year, about half of the posters that were submitted, 70% of the oral papers, and only 40% of the pre-conference courses. So a lot of factors go into how we judge these. And we're going to try to be as transparent as we can in terms of this in some of our subsequent presentations. But some of it has to do with just kind of what has been submitted this year. If we get 50 submissions on catatonia, there's only so much catatonia people want to hear about at the annual meeting. So we do need to kind of like think about how we can kind of have things be kind of covering the breadth of topics that we really want to. So if your submission isn't accepted, don't get super depressed about it. Don't get super bummed about it. It may certainly be submitted the following year, or you can certainly kind of try to talk with people and get a sense of what you could have done differently to try to make it more appealing to folks. So I think that's all that I really had. So I was going to pass it off then to Natalie Jacobowski, who's the chair of our general session subcommittee. So Natalie.
Perfect. Thank you, Chris. And that lead in kind of comes into some of what we're going to talk about from the review process in the spirit of kind of understanding where that happens and coming from the committee with the lowest acceptance rate as we keep getting more and more better submissions. My introduction again. And so there's 2 things during the abstract review that we do. The first phase, and this is the same for general sessions as well as for the BOPs and posters. The first is that there is ACLP members who review with content expertise who volunteer. They get a 1 to 10 scale of recommendation for acceptance, and they're asked to consider broad interest to the community, the meeting theme, originality, obviously the strength of the abstract itself, and the contribution to the breadth and depth of the scientific program, as Chris was talking about. And so then we get that initial data from them, and I'm going to talk a little bit of how general sessions processes it after that. But then I want to talk first about what the general second phase of review is. On the next slide. And the second phase happens by the committees, either the General Sessions Committee or the Brief Oral Papers and Posters Committee. The members get asked a few additional questions when they're doing the review to help us get a little more nuance. Asking about, does it incorporate the meeting theme? How will it meaningfully enhance the depth and breadth of the scientific program? How relevant is it to the practice of inpatient and outpatient CL psychiatry, as we all appreciate some strong research presentations and relevant practical presentations that are for different specialties? And how novel is this topic of submission? To Chris's point, there's always new things to learn on catatonia presentations, but there are many other topics of CL psychiatry that are incredibly important. And as we look at this with the meeting theme, I want to note that we don't specifically rule it out if it doesn't specifically meet the theme, but it just is a factor in the consideration. And then using these factors, we use the same 1 to 10 scale for acceptance. And so I want to look at what happened in 2024. We had 203 abstracts. And if you notice, we had an increase from about 150 to 200 last year, and many strong abstracts. The first review, we accepted some of the top scoring abstracts. The lowest scoring abstracts are rejected, and really at the lowest number of them. And as you can see, we send a majority, almost 70%, onto committee review. When the committee reviews, we go through those factors as below, but the other part we really consider is the overall program content. Is that we know there are some themes that get a lot of presentation submissions on delirium or medical aid in dying. And there may be several strong submissions, but we also want diversity in the content. This is where we also look at the diversity within the presenters and sorting through live and virtual sessions. Next slide, please. So updates for 2025. We're keeping the 75-minute duration that we instituted last year. We will be trying to have some increased monitoring and regulation to help presentations meet that, as we know that was a challenge at last year's annual meeting. And I wanted to reference the increases in the annual meeting, or in the general sessions over the last 2 years, as we went from 45 to a little over 60 last year, and the hope is getting about 90 live sessions this year. So there really is a significant increase, and the general ACLP as a whole has been trying to create more opportunities to present. Next slide. And so my tips to the general sessions submissions are to make sure you make it suitable for the 75-minute time frame. You also want to craft a strong abstract, obviously, that both is strong in terms of the content and the plan for presentation. And Vakara is going to speak a little bit further in our next slide about that process, but especially for general sessions, because it's a live presentation, we want to know how you're going to present and engage your audience. And to really think about breadth of your speaker lineup, because we want to have different people of different career stages, different personal and professional diversity, and from different institutions. And that is one of the things that can limit your abstract, is if you don't represent multiple perspectives of other institutions. All right. Sorry for not quite being ready on cue, but here is Vakara.
Thank you so much. I'm Vakara Meyer-Kari, the chair of Oral Papers and Posters Subcommittee, and I'm just going to briefly talk about some tips for submissions, some general submission reminders, a couple of updates for our specific subcommittee, and then just a little bit more about how we evaluate our posters particularly. So a lot of this you have heard before from Natalie and Chris, but I'll just say it again. So we will, look closely at those submissions that are relevant to the annual meeting theme, but by no means does that mean you should not submit other Sorry, I'm getting phone calls. Does not mean you should not submit other topics that are of interest and relevance to the CL psychiatry community. We do want to see a wide variety of topics at the meeting. One of the things is we all love PowerPoints. We're all sitting here listening today, but we really want to see how, when you're putting in your submission, how are you going to increase the engagement of the attendees at the conference? Is that going to be a breakout session, a poll, a pre-test, a post-test? We want to see how you're going to directly apply that knowledge or skill to the audience so that they are taking something home from the presentations. When possible, submitting original content is always helpful and something we do, again, take a closer look at. Write a strong abstract. So you only get 450 words to clearly tell us in an organized manner what your topic is, how you're going to present that, what is the timeline. You know, it is not a requirement to get into medical school that we be good writers. So some of us, that's a strength more than others. So if you know for yourself that that is not something that is a strong point for you, please have somebody look at it, a mentor, a peer, just to look for grammatical errors and just clarity of writing. It's been said before, but include a strong speaker lineup. And I think this really ties into the statement that utilize the contribution of CLP 2025 statement that Chris was alluding to. We've got a really neat, diverse group in the Academy. And so we'd love to hear from new voices, you know, people with different viewpoints, again, different backgrounds personally and professionally. You know, again, we by no means does it have to fit the annual meeting topic, but we want to include at least some of those topics that are not talked about as much, those patient populations that we maybe don't touch upon as much. So think about that when you're putting in your submission and really try to tell us how it's going to enhance the program. Because I think, as others have said, we often will get several submissions of the same topic. And if we're looking at them and they're pretty close in terms of how we're grading them, you know, what you tell us in terms of how you're going to share that to the program might just edge out your submission. Next slide. These are just some general submission reminders. Be careful when you're entering your authors and your co-authors for oral papers and posters. Once that April 1st submission deadline passes, you aren't able to add any authors, substitute them in, or change the order. What you can change is the presenting author designation, and that can be done all the way up to the week before the meeting starts, but that is taking into account that that author was already on the submission. So you, again, cannot add anybody new. Prior publication, we get a lot of questions for our subcommittee between April and November about this. So work cannot be published prior to April. If you have presented it somewhere else, that's fine. You just have to be able to describe to us how you're going to be presenting novel content. Did you get new results in? Did you do another survey? Were there multiple learning points or viewpoints and you've presented one and you're going to take a different stance this time? So you just have to be able to clearly describe that to us. Publication or presentations that occur between the April submission and the November conference need to be cited on your brief oral paper presentations or somewhere on your poster. This was something we changed in the last year or so, and we're going to keep going forward, but I think it's something that's worth reminding people of. A person can only be a presenting author on one accepted poster. So if you put in multiple posters that get accepted, you need to have other authors on those that can be designated as the presenting author and that are going to be present at the meeting. So for example, if you put in 4 posters and you're the only author on all 4 posters, you're going to have to withdraw 3 of them. Because just like you would need to be present for your brief oral paper presentation or your general sessions presentation, you need to be able to be there in person for the poster session. Next slide. We do not have a lot of updates for brief oral papers and posters this year. Last year, we actually decreased our sessions down to 75 minutes, and we're going to maintain that. That allowed us to increase the number of sessions and speakers, which will be even further increased this year with starting earlier for the meeting. We're going to keep the live in-person sessions as well as some of those pre-recorded sessions, and we'll come out later with the date that those are due. Typically, it's an October date where they need to be recorded, but someone can correct me if we know what date that is. Posters, they are a little bit different in that we will grade them much like Natalie talked about with the reviewers and then the subcommittee reviewers. But one of the things we do differently is we grade those on site. So if you want yours poster to be eligible for a grading and an award, the completed poster will have to be uploaded by a specific date in October, and we will, make that date known for people. As Chris said, we are going to change from 1 poster session to 2. So rather than just be on Thursday evening prior to the welcome reception, we will put it into 2 poster sessions. Again, to maybe decrease a little bit of the chaos, give a little bit more space, allow people to really walk around and talk to those presenters who have put so much effort into their posters. And then finally, the evaluation of the brief oral papers and posters is exactly the same as the general submissions. As Natalie talked about, we're going to use those same criteria, the clinical applicability, originality, strength of the scientific rigor, and clarity of writing, along with those 4 questions. Is it relevant to the theme? Is it original? The posters are a little bit different. We're going to use that same criteria and then again do that in-person grading where when we come around, members of our subcommittee are going to be asking questions of the presenters, and we're going to be looking at your knowledge of the project and content based on your answers, and just some of the aesthetics of your poster. Is it too busy, not busy enough? How did you organize it, and what graphics are you using? And just kind of a tip for that, we've seen in the past years, people have started to put QR codes on their posters if they want to link additional material online and not, overwhelm their poster.
Hi, I'm Marion Fireman. I'm the chair of the pre-conference course committee, and just going to give you a brief overview of our process. Can I get the next slide? Okay, so the pre-conference skills courses, as you heard, are going to be on Wednesday morning instead of Wednesday afternoon. Anybody can attend, but there is an extra fee required for these courses, so just keep that in mind. I'm not sure if it's discounted for trainees or not. That's kind of above my pay grade. The people presenting in the pre-conference skills courses must be faculty members at their institutions. You can be an MD, a DO, APP. We do limit it to 5 faculty per course. No trainees can be faculty members, including current fellows, but if somebody is a current fellow at the time of submission, like if they're a fellow right now, but they'll be on the faculty next year, that's totally fine. And one of your faculty should be a member of the academy and should be a mid or senior level expert in the field, because people are paying for this. So the submission should be courses that teach relevant clinical skills. So examples of successful courses in the past, the one on EKG and QTC prolongation assessment, where the skills are taught and then they're actually implemented by the audience. Examples are given and people have to figure them out. Last year, there's a neuroradiology course. Kind of similarly, people kind of taught what you're looking at and then gave unknowns for the audience to figure out. And in the past, there was one assessing the complex critical care patient where examples were given and the audience actually had to figure it out. So we want it interactive. We want you to actually learn a skill. The audience should be involved. If it's largely didactic, you'll be asked to revise it, or it will certainly get a lot lower priority. We consider submissions that appeal to a wide audience and will attract attendees. So when you're doing your submission, think about, well, if there are only like 20 members of the academy even interested in this topic, and we would only expect 5 or 6 to sign up, we probably won't be looking at that all that favorably. This year we have capacity for 8 courses. So what we're limited by is number of rooms we have, the number of courses we think are reasonable so that we don't have rooms with only 5 or 6 attendees. We think about what's been submitted in the past year. Should we repeat it or not? Will it attract a large enough audience? Some years the president program committee invite courses, so that does limit the number we can accept and the number of proposals we get. So some years we get very few proposals and we accept virtually all of them. Last year we had a lot of proposals and we could only accept 6. So that was probably one of the lower percentages at 40%. So I think those are some of the factors that go into, whether submission is considered favorably or not. Next slide. These, again, they're going to be Wednesday morning. It'll be November 19th this year. It's going to be from 8 a.m. to 12 p.m. Plan to start on time. If you're going to submit, use the usual abstract submission process. if you're going to include pre-recorded content, say you have a lot of didactic stuff, or you want your audience to come prepared to kind of do some work on the topic, in the past, we've had the capacity, and we'll try to do it again this year, to have some prior work. Try to keep it short, no more than 60 to 90 minutes, because otherwise nobody will actually look at it. And again, the 5 presenters in total should be the same people on the pre-recorded or as in the live content. If you have, a total of 10 presenters, we're not going to accept that. And again, you should look for having presenters across institutions, or some diversity of training. So we're not hearing from the same people in the same department at the same institution. We'd like, other perspectives as well. Next slide. Okay, so what's a successful abstract? Well, one that's going to attract interest, one that has some originality, one that's actually teaching skills, and you describe how you're doing it. Tell in your abstract how you're going to spend your time. How is your abstract well written? Do your speakers have expertise in the field? Do they have the clinical skills and the ability to teach? We want people from more than one institution. No speaker can be in more than one skills course. So if somebody's in more than one submission, which has happened multiple times in the past, if we accept them both, they have to be replaced in one of them. So, and if I'm not sure this year how the morning's going to go, but if they're teaching in the APP course or they're part of the research colloquium, and those things are going on at the same time, the idea is people are paying for your course. You need to be in the room the entire time for your course. Can't be running off to another room because the audience may have questions and the speaker is now gone. So deadlines. We review the courses, review all your slides. The deadline for sending in your slides is Wednesday, August 27th. And if your group can't meet the deadline, consider whether you should actually submit the proposal. I mean, every year, and we send out multiple reminders, and every year there are people who, the week before tell me they need another month and a half. So we're getting the slides then in early October, which gives us hardly any time to review, send them back, ask for revisions, ask people to revise their course. If there's an issue, we want to give us plenty of time to review, our committee plenty of time to discuss it and get it back and get the revisions, because we want to give really high quality courses. So if we're getting the slides in October, that's not going to really give us enough time for a good review, to give good feedback, and for the people to revise. You usually don't ask people to again resubmit their slides, but if there's a question, sometimes we will. So we'll review, we'll give feedback, and please send your revisions in a timely fashion. And that's all I have. Thank you.
Hello, everyone. My name is Mona Mojtahedzadeh, one of the members from the DIA subcommittee, presenting today on behalf of Dr. Ariadna Foray, one of our co-chairs. So considering the recent and very rapid shifts in the political climate, we understand the reality that for example, many members within certain healthcare systems are facing external pressure, as Chris said, ignore the value of DIA. So the name to really exemplify the concept still is going to be now integrating depth and range into the program. And we want to acknowledge that it is like a dynamic process for us, and we are growing, remaining respectful and adaptable, while our mission stays the same, which is a reflection of the ACLP mission to bring being there for all, fostering a sense of belonging, and emphasizing fairness and empowering active participation from all members. So this could include, but not limited to, a focus on anything, and the theme for this year is part of our mission, novel or the innovation, anything innovative. So it could be in the submission topic, it could be patient population that have been understudied, multiple viewpoints on a topic, in the speaker panel, as it has been discussed multiple times, and new research findings. So, for example, we can present multiple viewpoints on a controversial topic, present on a topic that hasn't been covered at the ACLP annual meetings in the past several years, document and critic health and healthcare disparities within the clinical topics presented, and discuss about accessibility to care to diverse populations, discuss ways to promote health equity, reduce health and healthcare disparities, and improve the health of historically marginalized populations or those, again, with poor access to care. If no research or evidence exists on health and healthcare disparities on the clinical topics presented, discuss why and suggest targets for future study. And then incorporate health and healthcare disparities and health equity and structural competency into core educational content. So as you can see, the concept stays the same. And as I mentioned, this is to provide as much sustainability to the efforts that we all as a group are bringing into the program and into our annual meeting. Next slide. And present examples of public service for diverse populations, outreach, partnerships with community-based organizations with the goal of improving health and wellness in communities, develop or use pedagogies that address different learning styles and learning disabilities, advance equitable access to education and outreach those with poor access, develop and utilize resources and tools that encourage the recruitment and retention of diverse learners, faculty, and staff, and assist attendees from historically marginalized groups toward academic and professional advancement within their institutions and ACLP. Includes speakers, representative of a variety of identities as far as age, race, ethnicity, gender, sexual orientation, and disability, and going on, incorporate speakers from different professional backgrounds, non-psychiatrists, physicians that are non-psychiatrists, physicians, advanced practice practitioners, social workers, nurses, spiritual leaders, community leaders, and PTOT, basic scientists, engineers. Include speakers from varying career stages, trainee, early career, mid-career, late career, mentor and sponsor, speakers from earlier career stages, historically marginalized groups. There are a couple of examples here that we thought could maybe help as far as the statements. For example, our patient is a female from an underserved population struggling with severe mental illness who was struggling with a somatic complaint, which can be often disregarded as a manifestation of their mental illness. So as far as like the ways that symptoms could be expressed in different populations that have been less studied. We also, for example, another example, we also have a diverse group of presenters who collaborate on this poster, have different backgrounds, and bring unique perspectives on how to improve health equity and reduce health disparities. By highlighting the experiences and perspectives of a diverse group of presenters, we can challenge assumptions and stereotypes, reduce stigma, and promote empathy and understanding and better care. This submission, for another example, aligns with the broader theme of the annual meeting by addressing how CL psychiatrists increasingly collaborate across diverse medical disciplines, from neurology and cardiology to immunology and infectious diseases. Another one, as medicine evolves, new discoveries in areas such as gut-brain interactions, so talking about new approaches, are reshaping psychiatric care, and our submission will highlight how this approach, for example, or these advances can best be integrated into CL practice. Is it advancing the advanced? Is it like how much of it is it advancement? How much of it is over medicalizing, for example? The diversity in our patient population is a testament to how the overall US population is evolving, so needs the field of CL psychiatry. This is for us to be able to meet the emerging challenges that encompass global health. One example. And the last one, our submission will explore systematic barriers and propose innovative models for more equitable access to mental health care among those with medically complex illnesses. Thank you very much. So really to emphasize on maintaining diversity in submission topic in multiple viewpoints, population content, diverse range in methodologies, and then presenter diversity as been discussed here. Thank you.
Priya, is that the end of all our speakers? All right, wonderful. Thank you, everyone. And there's a lot of you that are here. We're open for questions. If you want to type it in the chat, that's fine. And if you want to raise hands, I don't have to go across. But if you have questions, please type it in the chat, and then we'll call on the people who are best suited to respond to them.
Can I ask a question? Is that okay?
Please, let's get everyone started. There were a lot of questions here, so
this question is for Chris around the speaker limits. I know you said it's a max of 3 speakers. I thought I saw online that includes like general sessions, brief oral posters, like basically, or brief oral papers, all of it all together. Is that correct? Okay. I just wanted to
that's
confirm
right.
that.
Yeah, so I think that so I would say the way that it works is basically if you're going to be speaking at the meeting, yeah, in the general sessions or a brief oral paper, then that kind of counts. You could be on a brief oral paper as a co-author, but not speaking, or you could be on a poster. That kind of doesn't count. It's really general sessions and brief oral papers that limit of 3 comes together.
Great, thank you. And then we have a question in the chat. Do we have access to the recorded version of this talk?
We will have access to that. I think that Autumn should get it up in the next day or 2, but it's not going to be available immediately, but it'll be up soon.
Question in the chat. Does that also include pre-conference sessions in the limit of 3 in addition to the brief oral papers and the general sessions?
I'm glad we're kind of like drilling down on this. I would say
having it been something in the past that we've considered as presentations.
yeah, I would have. What have you guys done before? Have you considered that?
Historically, we have.
Okay.
And not to throw you on the spot, but I feel like as we're clarifying those questions, it is really helpful.
So then, yes, I would go. I would go with that too. Yeah.
The other comment I was going to add, but not a question, but I realized as I was presenting the slides that I hadn't put in is we have more topic tags when you put in your submission this year that we are hoping to be able to use to then translate into topics at the meeting that you can track different tracks. Because we know historically a lot of those have been created a little bit ad hoc after we have submissions and have to be limited to a certain number, which sometimes doesn't best represent your presentation. So we're hoping this will both help best represent your presentation and ease of searching through the presentations on your different topics of interest.
Chris, in terms of the topic of the meeting, again, a couple of questions that have come across. I sit in with ECP and other subcommittees. Is this going to be a heavily research focus? Like people know that a bunch of you are researchers this year on the annual meeting subcommittee. So is there going to be a heavy emphasis on research?
I don't think so. I don't think that's the intent. I mean, I think that we would love innovations in education, innovations in clinical care, innovations in research. Anything that's innovative, I think we kind of think would be great. And I think some of our plenaries are a little more kind of like researchy or science kind of focused, but hopefully we'll have a lot of clinical applicability. And I think that yeah, certainly, no, we don't want it to just be a research. I mean, I totally recognize that the vast majority of our membership are primarily clinicians, and I think that that's one of the reasons why I love ACLP, that we focus so much on clinical care. So I think that certainly having things that focus on clinical care would be really important.
I have another question, so I'm gonna throw it out there. For the recorded content for some of the virtual presentations, do we have a timeline for those? Because I know Marion talked about the timeline for pre-conference materials, but my recollection is that the recorded content had an earlier deadline as well, which might be relevant to the group.
Yeah, I don't think we've established all of the details because our new management company is starting April 1st, and they're the ones actually who are going to be doing managing all of this. So I think that's part of the discussion that we'll have with them. So I don't think that I certainly don't know right now, but my hope is that by the time people get their acceptances in June, like June 2nd, in those kind of notification emails, we'll be able to give a specific timeline for when everything needs to be updated. I do think that last year, if you were doing something in person, I think they wanted posters by like October 15th if they were going to be judged for the kind of best poster awards. But I think otherwise you could get your stuff up pretty up until like a few days before the meeting if you wanted to get it in there for the website. But I'll update all of that once we know with our new company.
Chris, I know historically there has been emphasis on trainee participation, whether it's in posters and in conference courses. Can you comment on what is kind of the position this year?
Yeah, I mean, I think we would love, I mean, I think with the exception of the pre-conference skills courses where I think it has to be faculty members and don't allow trainees, I think we would certainly love and encourage trainees to be involved in everything. I think that certainly adds to the the depth of the speaker lineup and the diversity of the speaker lineup, and having kind of trainees as well as kind of established clinicians. So I think we would certainly be encouraging trainees to submit things. And if you have trainees who would be good for a talk you're thinking about, that would be great to have them involved.
In line with this, I wanted to ask Chris, do they need to be a member of ACLP? Anybody outside of our committee, outside of our organization who wants to be collaborating on a presentation?
No, you don't need to be a member of ACLP to present, but if you are going to be in person and presenting, you do need to register for the conference. So that would be the one. That'd be the one thing. There are one-day registrations that you can do for some folks, but if you've got like an anesthesiologist or somebody who's coming who's not in ACLP, they can certainly still come, but they will need to register for the day that they're presenting. And maybe they'll want to become a member. Who knows? That would be great.
Any other questions? Otherwise, I'm itching to ask one question. One question that comes to mind. And Priya and I were chatting about this. Again, this may be something to think about in the future. But trainees and AI. Is there any kind of thought about that? Like that's kind of one of the common things. Is I think that very soon we're going to need to start to think about, was AI part of this? Did you use that? Kind of having those statements. So any thoughts? And again, from the group as well. I've been struggling with this, and Priya and I were just chatting about this yesterday.
I guess I'll take that one. I don't think I don't think we've thought too much about AI as of yet in terms of whether or not people are using AI for their abstracts and that kind of stuff. There might be something in the submission guidance, but I would have to double check. I mean, my general sense would be don't use AI to write your abstract. That seems not that. I would kind of try to use the same kind of thought about how you would kind of submit an abstract or a paper to a journal where they kind of don't allow those things. So I would say it should be your own work. It shouldn't be generated by AI. But I could imagine I could imagine some pictures or something that was created by AI within like one of your slide decks or something that I don't know how I would think about that. I don't know. this seems like it could be a general session in and of itself,
I
talking
think
about.
so, because I think a lot of questions are coming around this, and just from the working with trainees, I recently had to have deal with situations where people were getting references out of AI that were completely incorrect, and it was just like I was like, I need to start. I think that's kind of the pitfalls, and I think the younger generation, or at least medical students, they're all into this, and I don't know, for those of you who are in residency programs and working with trainees, I'm sure you're starting to see some of this kind of trickle in, and I think kind of warning them, or I don't know if you guys have thoughts, but I think that's an important thing to consider as we move along.
Yeah,
And I think some journals actually have acknowledgement statements now too. I feel like I've seen those on submission pages, like check this box if you used AI for any editing or anything along those lines.
yeah. I was recently reviewing an article where somebody used ChatGPT as a reference for like something that they cited in their article, and I was like, that does not count. That is that is not real.
Do the SIGIN committee chairs know that the designation is going away this year?
Well, that's a good question. It is on the submission guidance page, but I am planning on sending, I mean, it's on my list in the next day or two, hopefully, to send something just to the SIG chairs, because I did hear that some SIGs or subcommittees are talking about sponsorship again this year. So I will certainly communicate it to the chairs.
And I would say from the general sessions perspective, I know we sometimes get some that are the multiples that are mentioned of SIG supporting them, but sometimes get a presentation that a SIG really has specifically worked together on or planned. So if that is the case, I would encourage, please put that into your abstract so that we can recognize that, because we do want to support those work of the SIGs. And when it really has a lot of extra dedication to it, it's worth you making that known.
Yeah, I think for me, just looking at the comment about ChatGPT and the references, I think that's okay. I think it's okay to use ChatGPT as long as you then get the references and read them yourself and confirm that it says what ChatGPT is saying. It's kind of like when you use a review article to cite a paper, but then the review article actually didn't cite the paper the right way, or say what the paper said. So I think just trying to be double checking is important.
Any other questions? Any last questions? We'll give people back a few minutes if there are no other questions. Is there anything else people want to emphasize, or any other questions? Oh. Priya?
No, and I don't see anything in the chat either. So.
And I think I actually, Chris, I looked at the website. I think I really like the way you'd already put everything out, like during the abstract submission. There's a lot of clarity in the way things are presented this year. So I thought that was very helpful already. So it's possibly a lot of it has been captured in the document you posted this year. So I think that's extremely helpful.
Well, thank you. A lot of it was from last year. We did update a little bit, but I'm glad
it's very clear. I don't know. I was there last year as well, but I think the clarity is it's very clear. Like highlights of the meeting and all that. So I think it's coming across really clearly. So I think that's
cool.
really good.
Thank you. Awesome.
And
Thank you, everyone.
Thank you for mentioning the website in there. Sorry, one thing that I just remembered also, the mentorship subcommittee does have materials on the website as well. And if you need, any guidance or anything like that, you can take a look at that as well, or you could talk to any of us on the subcommittee. Sorry, in there, I just remember that I was supposed to say that.
Awesome. Well, thank you guys. I mean, thank you guys for being here and for kind of thinking about submitting. I mean, I think the annual meeting really depends so much on its content. I think that's why people come, and that's really what makes the annual meeting great. And so I think all of you and all of your work, I recognize all of the work that goes into it. So I'm just super appreciative that you guys are thinking about submitting, and hope that you guys submit a lot of abstracts. Bye, everybody.
Bye.
You.